This next question is about healthcare, and it goes first to Sal Peralta. What do you plan to do, or are you now doing, in order to address the healthcare crisis in the state of Oregon? And in particular, this question asks how you would deal with the question of children who lack healthcare insurance.
Well, I'll just reiterate the point that I made earlier. 600,000 Oregonians are currently without health insurance, and many of those are children. We need to make sure that every child in the state is insured through the Oregon Health Plan at a bare minimum. There have been some really interesting reforms that have passed in Massachusetts. The Republican governor of Massachusetts, Mitt Romney, pushed forward a reform that basically said that every person in the state of Massachusetts is going to have a basic health care, a right to have basic health care. And so everybody pays into kind of a single payer concept, and then if you want additional health care on top of that, you can go to your private insurer and just purchase health care over and above that base level. I think that is the direction that Governor Kitzhaber wants to go with his Archimedes project, and I think it's probably something that we should look into as a state, because when we have a large population of uninsured people as part of the system, the costs for insuring the rest of us increases dramatically, because the insurance companies and the doctors need to generate their profits from the people who have insurance. So it makes your health care more expensive. It makes my health care more expensive to have a large population of people who are uninsured. It also means that when folks who without insurance do go to the hospital, they are going into emergency rooms, which is actually the most expensive way to deliver health care today. And so I think the answer is to provide health care for all Americans, all Oregonians. And I welcome ideas to move in that direction. I think another thing that we should look into, and there's a ballot initiative that we'll be voting on, I believe it's Measure 44, that will create prescription drug pooling here in this state. I'd love to talk about that a little bit more later on in the debate. But my time is up, so thanks.
Thank you very much. Yeah.
Ronald Reagan had a famous quotation about what government does when it sees things that are not moving. It subsidizes it. If it is moving, it taxes it. Oregon doesn't do too bad of a job as far as providing medical insurance for employed people. About 65% of the premium of family care is provided by employers. But if there's a downturn in our economy, of course, those figures could be changed considerably. Currently, a taxpayer can only deduct medical expenses in excess of 7.5% of their income. We need to change that. We need to exempt medical insurance from that restriction so that we're not pound foolish by using, as he said, emergency rooms for doctor calls. We need to take the money that the taxpayers currently pay for indigent care, not tax people more, but using the money we already have to provide, on a sliding scale, insurance for the less fortunate. We need to allow and encourage insurers to provide plain vanilla insurance policies. Too often our policies are mandated by states. You must carry this. If you have 20 employees, you must provide maternity care, even if they're all men. Psychiatric and drug care is mandatory in the state of Oregon. People have no choice in the kind of care, and therefore they're all buying Lexuses instead of Chevys. We must encourage incentives to employers to do health insurance through tax deductions for employers. And we need to provide an easy, accessible database for which people can find out what kinds of policies are available at what cost. Then we can talk about the more draconian methods of providing government-supported insurance. After that, it doesn't work.
Thank you very much.
Yes, thank you. I spent a great portion of my day today trying to get a 29-year-old who needed an evaluation at OHSU for a heart condition to determine if he really needed heart surgery, and working with our Yamhill County Mental Health Group. I was very disturbed because we allocate a large sum of money to OHSU to provide for medical services for the indigent. So immediately got on the phone, called Dr. Van's office and asked him how he was being refuse to do this. Number one, I think we need to do what we are directed to do by law, and when those monies are available for these individuals, that's where it should be used. We have tremendous problems in the state, and I work on them every week with Medicare and Medicaid. I cannot tell you how many people are denied. I have an individual who will be 50 years old in March who was paralyzed from a stroke at the age of 3 months. I mean, gets a form back that's from Disability Health and Human Services that says, we have no proof that you're legally disabled. I'm saying this Health and Human Services division of ours, Dr. Goldberg, who I do respect, needs broken up, needs oversight, needs civic and civilian involvement. And we have enough money to provide adequate health care. We have a million individuals in our state that do need this health care, and there's certainly no reason that our children are not taken care of. The sadness is we have to have leadership at the very top. We can pool our vast purchasing power with adjoining states and offer health care, appropriate prescriptions at a proper, affordable cost for our precious seniors, our disabled, or veterans. And we need to do so.
Thank you very much.